Gastroesophageal reflux disease, or GERD, is a condition that causes the burning sensation known as heartburn. When you swallow, food passes down your throat and through your esophagus or food tube to your stomach. A muscle called the lower esophageal sphincter controls the opening between the esophagus and the stomach. This muscle remains tightly closed except when you swallow food. When the sphincter fails to close, the acid-containing contents of the stomach can travel back up into the esophagus. This backward movement is called reflux. When stomach acid enters the lower part of the esophagus, it can produce a burning sensation commonly referred to as heartburn.
In this condition, it requires surgery named Nissen fundoplication. In this procedure, the surgeon wraps the top of the stomach around the lower esophagus. This reinforces the lower esophageal sphincter, making it less likely that acid will back up in the esophagus. Now that I explained how Nissen fundoplication surgery is, let us portray the surgical safety checklist for Nissen fundoplication surgery. Let's start.
Good afternoon, doctors and nurses. Today is 3rd of April 2023. Our patient name is Shin Hari, 29 years old, from Sibilia City of San Fernando, La Union, scheduled for Nissen fundoplication. Doctors and nurses ready for sign-in. Our patient name is Shin Hari. The site is the lower part of the esophagus at the junction between the esophagus and the stomach. The procedure is Nissen fundoplication. Consent for Nissen fundoplication and general anesthesia induction secured, signed by the patient itself. Kapulas, is the site marked?
Yes, the site is already marked.
Dr. Hafalia, is the anesthesia safety check complete?
Yes, it is safety check complete.
The oximeter of the patient is connected and functioning. The patient has no allergy. Dr. Hafalia, is there an airway difficulty or risk for aspiration?
There is no airway difficulty and no risk for aspiration.
Plus, is there a risk for greater than 500 ml blood loss?
There is no risk of blood loss of more than 500 ml.
Doctors and nurses, sign in complete. Excuse me, doctors and nurses, ready for timeout. Surgical team, please introduce yourself by name and by role.
I am Dr. Sharami Kapulas, your today's surgeon.
I am Dr. Jamie Hafalia, the anesthesiologist.
I am Kelvin Luiabat, your scrub nurse.
I am Jadrio Gadingan, the circulating nurse. Dr. Kapulas, kindly verbally confirm the patient name, the site, and the procedure.
The patient's name is Shin Hari. Site is the lower part of the esophagus at the junction between the esophagus and the stomach. Then procedure is the Nissen fundoplication.
Dr. Kapulas, what are the critical or unexpected step, operative durations, anticipate blood loss?
None so far for the critical or unexpected step. The operation will last around 3 to 4 hours and there is unanticipated blood loss.
Dr. Hafalia, are there any patient-specific concerns?
Are all the materials complete and sterile?
Ms. Apat, has sterility been confirmed?
Yes, sterility has been confirmed. No issues and concerns with regards to materials, and all the materials are functional and complete. So let us check for the number of equipments. 1 surgical tray, 3 surgical scissors, 3 surgical knives, 3 surgical tips, 3 surgical forceps, 3 surgical needles, 1 surgical thread, 10 cotton balls, and 5 wound care pads. All instruments, sponges, and needles are complete and counted. Preoperative antibiotic was given within 60 minutes. Preoperative antibiotic is started. X-ray and MRI films displayed.
Thank you, doctors and nurses. Time out complete. Excuse me, doctors and nurses, ready for sign out? The name of the procedure is Nissen fundoplication. Let us check the numbers of equipment. 1 surgical tray, 3 surgical scissors, 3 surgical knives, 3 surgical clips, 3 surgical forceps, 3 surgical needles, 1 surgical thread, 10 cotton balls, 5 wound care pads. All instruments, sponges, and needles are complete and counted. Dr. Kapulas, Dr. Hafalia, and nurses, are there any key concerns for the recovery and management of the patient?
Please contact the technician to repair this surgical lighthead.
Upper process, add more surgical needles. Please instruct the patient to follow liquid diet, avoid drinking ice, hot or carbonated beverages, and avoid foods that stick together, and limit foods that produce gas.
Additionally, make sure to clean the incision wound with betadine to avoid infection.
Thank you, doctors and nurses. Sign out complete.